How to lift objects when pregnant. Lifting heavy objects while pregnant is often considered harmful and is not usually recommended. It is easy to strain your back when carrying extra weight, and softer ligaments during pregnancy can make you more susceptible to injury. However, there are times when lifting items is necessary, in which case knowing how to do so properly is a good idea. You will first want to assess the item to determine whether or not you are able to lift alone or if you require help. Then, when you lift the object, you need to rely on your arms and legs while keeping your back straight. Listen to your body throughout the process, it will give you signs as to what it can and can't handle. Approaching the object. Decide whether you should lift the object in question based on its weight. The amount of weight that is generally safe to lift is connected to your stage of pregnancy. The more advanced your pregnancy, the more you should avoid lifting heavy objects. The frequency of lifting also matters, with occasional lifting being less risky than everyday actions. Up until the 24th week, it is generally okay to lift more than 51 pounds, 23 kilograms regularly if needed. However, it is still better if you lift this amount only sporadically if possible. 1. After the 24th week, you should limit any constant lifting to a maximum weight of 24 pounds, 11 kilograms. 2. After the 30th week, you should eliminate any constant lifting and only sporadically lift up to 24 pounds, 11 kilograms, if necessary. 3. Divide or break up the object if you can. When possible, divide large loads of materials into smaller groups or make several trips, rather than carry a heavy load at one time. For example, if you have one large box of books, see if you can split it up into multiple carry bags or smaller boxes before moving it. The extra effort could save you from back pain. If you choose to divide the object up into bags, choose bags with handles. They will be easier and more stable for you to lift and move. Also, consider pushing or sliding the object to its final destination before you lift it. This may work especially well with an object that only needs to go a short distance on a smooth surface. Stand in front of the object. If you do decide to lift the object, position yourself as close as possible to it while standing. Space out your feet about a foot apart or a little more depending on the size of the object. Keep them parallel to one another. Make sure that your feet are stable and planted firmly. Never lift a heavy object on unsteady ground when pregnant. The shifting ground makes it more possible that you could lose your balance and fall, possibly injuring yourself and your baby. This is especially the case if you are in the latter stages of pregnancy and your balance has shifted forward, throwing off your center of gravity. 4. Assume the squatting or kneeling position. Squat down while standing near to the object. The item to be lifted should be positioned between your knees as you go down. If you need extra balance support, slightly slide one foot forward an inch or two. If your belly hits the object at any time, with either position, you are too close and will need to move back slightly. After you've gone down into a squatting or kneeling position, if you feel as if you can't lift the object or even get back up, simply sit down on the ground. It is better to pause for a moment rather than risk injury. Hold your back straight. No matter which initial position you choose, make sure to keep your spine straight throughout the entire process. Picture a ruler placed against your back and try to straighten to meet it. You could also wear a maternity belt to provide a bit of extra back support. Many pregnant women wear these on a daily basis as they lessen pain by encouraging proper posture and providing lift. Your back is particularly vulnerable to strain due, in part, to a hormone called relaxin which your body produces early on in your pregnancy. It increases the flexibility of your connective tissues in order to prepare your pelvic area for the birthing process. The side effect, however, is that it can weaken the back. 8.